Hello, and welcome to another episode of Social Workers Rise. It is your host, Catherine here. I am so glad that you're here. Today, we're going to be talking about the social determinants of health. And this is really important for you to know if you are in any aspect of social work or mental health care, because this is going to impact the work that you do and help to give meaning and reason behind it. Plus, also, if you can reference these in an interview, this will help you stand out among the other applicants, that you understand the macro impact of the work that you're doing in almost any setting, from community mental health to CPS, child protection services, to working in a hospital or any kind of medical social work. So these are really important to be able to understand what they are and how the work that you do fits into them. Before we hop into this, I just wanted to give a little update about what has been going on with me. To be honest, I've been a little MIA, or a lot MIA, from social media. I'm just in a period of my life where I have found that I need to retreat inward and find peace and solace within myself. And so I have been just putting up some boundaries around how much energy I am giving to others and giving to social media, and protecting that for myself to be able to give myself the energy that I need to be well and to heal and to find peace right now. So it's not that I have forgotten about you all on social media. It's not that I don't want to send you emails every week for Friday resources. It's just I am really conserving my energy so that hopefully in a couple months, I will be able to be back and energetic and be able to give you 110% and come back strong. So for now, I'm really just focusing on providing you good quality episodes on the podcast and interviewing really great guests that I think are going to add value to your career as a social worker. So that's just a little bit about, what's been going on with me. I do still offer career coaching. I am doing therapy sessions with clients, and I am still overseeing the Rise directory. We just put on 2 CE events for supervisors this spring, and we do have 2 more CE events coming in the fall. So make sure to stay tuned for that. If you want to be able to be updated regularly about what's happening with the Rise directory and also with Social Workers Rise, as far as guests that we have, episodes, resources, tools, courses, then definitely sign up for the email resource list. It's going to be, the link is in the show notes. So if you open up your app and you go to the show notes for the podcast, there's a link that says something about joining the newsletter. That is what you need to put in, just your name and email address. Super duper easy for you. So that is it. Let's hop into this conversation around social determinants of health. So this concept has been around for a long time now. And essentially what it is the social determinants of health are the non-medical factors that influences our health outcomes as humans. So they're essentially the conditions in which people are born, they grow, they work, they live, and they age. And they're also the wider sets of systems that are shaping the conditions around how we live. And I'm getting a lot of this information from the World Health Organization, and you're welcome to visit the World Health Organization website to learn more about these if you have more questions at the end. So these forces and systems include a lot of different areas. And I love this perspective because it's a very systems-based perspective. So in your social work education, you probably learn about systems and how they impact the clients that we work with. And so it's really helpful to know and be aware of the different systems that are impacting our clients and their overall health. So in a nutshell, these include 5 main systems. And these five main systems really impact the way that communities are able to live healthy, and they're able to provide guidelines around why there are health inequities in the different communities that we see. For example, I'm in California, and I'm in Southern California, which is a very affluent area of the country, of the United States. And so I'm able to see just the health inequities in two different counties. So I grew up in a poor, high poverty county with low resources, and the health of that county is a lot poorer than the health that I see in more affluent counties, because there are different resources. So there are definitely inequities even within the states that you live, within the cities that you live, within the counties, that one school district may be thriving and bustling and another school district may not be so much. So, and this impacts how the children that we work with, how they see the world, how they're interacting with it, and how their parents or their caregivers are able to provide for their families as well. And it's interesting because these are all systemic issues, meaning that the clients in them feel like there's something wrong with them. And even though that they can be doing the absolute best that they possibly can, there's still forces outside of them that are much, much bigger than them that are impacting the way that they're able to live. So it's not the client's fault. It's not always their fault. Some people, some people don't do the things that they need to do, and they choose to do that. While other families, they're doing everything. They're working their butts off. They are doing everything they possibly can, and it's still not working. It's not their fault. And this is going to give you a little insight into what those factors are. So generally, the social determinants of health are the conditions in our environments. So essentially, the big groups are 1, economic stability; 2, education, access, and the quality of that education; 3, healthcare access and quality; 4, the neighborhood and their environment; and 5, the social community and context. So I'll give you some examples for each one of these that helps to kind of break it down a little bit. When we're talking about economic stability, generally what we're talking about is what kind of jobs are available, what kind of economy is available locally to the people that we serve. For example, if you're living in Los Angeles or New York, chances are there's a lot of different jobs and careers that are open and available to people on all scales, from entry level to trained and advanced workers, right? Specialty skills. However, if you're living in a rural community and other communities are not as well, I don't want to say well developed, but they're just not as big. They're not as big as Los Angeles or New York or any of these major cities. For example, I have a lot of clients who live out in the desert. And while it is classified as a big city, there's not a lot of jobs available. There's not a lot of jobs that are available that, 1, that they qualify for, and 2, that are going to pay them the salary that they need. And 3, also too, if you have children, then now you have to figure out childcare, and what does that look like? What kind of resources are available for childcare and be able to pursue the jobs, right? So that's economic stability. Essentially, are there jobs available that our clients are able to qualify for and tap into? The next one is education, access, and quality. So growing up, like I mentioned before, I grew up in a high poverty area, and my school, we had to share all the books. So all the books for all the classes, there was a class set, and maybe sometimes we got to take home a used book from the year before if they were available. right? So sometimes we had books to take home to do our homework, and sometimes there's a class set. Other things are the extracurricular classes, if you will, or opportunities. For example, we didn't have very much extracurricular courses to choose from. For example, where some other people grew up in a more affluent area, they had cool programs like cooking, psychology, I don't know, a lot farming, a lot of other different types of resources. We just had kind of like five extra electives that we could choose from. Additionally, the quality was not that great. So the test scores that they gauge us on, which whether you like them or don't, it is what it is. Our county would traditionally perform very poorly, a lot of different reasons, right? While other affluent counties, neighboring counties would perform a lot better. And those who perform better, the way it works in California is you would get more money if you perform better. So the access and quality. Additionally, some people have to drive really far to get to their school. And if you don't have money for gas, you can't just walk. So it's not always accessible, right? Or if you're relying on a bus to get there, it's not always accessible as opposed to other communities where there might be a lot more schools closer by. So that's just, an example of the educational access and quality. Next is the healthcare access and the quality of that. So again, growing up in high poverty area in a rural community, it wasn't rural where I live, but people who are in rural communities, you may have to drive really far to get to a high quality place that provides good healthcare. A lot of healthcare facilities are understaffed. They don't have specialists that you might need there, as opposed to, for example, if you live in Los Angeles, there's UCLA, USC, very prestigious, high quality healthcare centers. If you have cancer, that is the place a lot of people send you, is to the cancer centers in Los Angeles. If you don't live in these major metropolitan areas, if you are in a rural community, you might have to drive very, very far to get to these high quality specialty physicians that you need. And they may not be accessible. And so unfortunately, you may die simply because you don't have access to the transportation that you need to get there. So next is the neighborhood and built environments. Neighborhoods vary so widely. Some are safe, some are not safe. Some have gangs that you cannot walk to your car feeling safe. Others are fine. Others do not have gangs. Some neighborhoods have sidewalks and they're very safe to walk down the street, to get your laps in, to get your steps in. Other neighborhoods are not so much. Other neighborhoods, there's no sidewalks. Again, it's not safe maybe to be out there alone, or maybe you don't want to walk with your children because there's I don't know, people who are homeless, people on drugs that are on the streets. So it really just depends. And the quality in the environments of these neighborhoods also impact your health as well. Because if you live in an area where, you feel safe to go jogging around the block by yourself, or to walk your dog outside, or to go to the park with your kids, and it's safe there. But if you feel confined to your home, then that's definitely going to impact the access that you have to really get out and be involved in the community, to walk to work, to walk to school, to take care of your physical health. All of these things are impacted by the neighborhood that our clients live in. And next is the social and community context. So some areas, what this means is the access to available everything, social clubs, grief support groups, different kinds of support within the community, friends, people who live nearby, just the community that we have around us. Some areas are bustling with opportunities to be social and to get out and have family events, while others are not so much, that they don't have that community feel or that community context, which is proven to reduce depression and increase your motivation and give you more purpose. So that is a very high level overview of the social determinants of health. Again, if you are going in for any kind of interview, working within any of these systems that I explained, it's very helpful to know how your particular role and how that particular agency fits into the overall social determinants of health, because you, by being there, are helping people get healthy, stay healthy, and reduce those inequities that we see so much within health. I hope this episode was helpful for you. If it was, please open up your app, share it, text it to a friend, make sure that they know about it. And with that, we'll talk next week.